After practicing psychiatry for 13 years, I realized that the stigma of getting help for emotional problems still very much exists. My assistant, Jenny Pfeiffer, and I have made this video to show and explain what someone can expect when they come to my office, with the hope that this will make obtaining treatment easier.
Sometimes people are very intimidated about coming to see a psychiatrist or very anxious about getting help in mental health anyway. What can people expect when they want to come and see you?
Yeah, that first step is I know that's the hardest. After 13 years of practice, I've heard that over and over. Normally when someone calls, they'll get you or me on the phone and we ask in more detail what they've been experiencing and what treatment they've tried to use. And then if we feel that we can help that patient, we'll set up a 45-minute consultation. They come into a reception area and they're greeted by you, and then we'll come in here and talk about the problem in more detail.
Well, since it seems that privacy is a pretty important piece to this, what other things do you do to ensure privacy for them?
Privacy is a big issue. It's so big that I actually built my whole practice around that issue. I have a waiting room that's got a keypad entry on it that ensures that the mailman or some other patient won't walk in on them while they're waiting. The waiting room is attached to my office directly, and when someone leaves, it's a different way than when someone comes in. The other way to ensure privacy is I don't work with insurance companies. This is very different than a lot of people in mental health. But insurance companies ask for very personal information to be faxed. The notes I take are for my eyes only. They're encrypted on my laptop and they don't go anywhere. In fact, we don't even have folders. Everything is online, so there's no paperwork with anybody's name set out for anybody else's eyes.
Oftentimes when I talk to them on the phone, I notice that they're pretty anxious about what to expect when they're actually finally sitting on the couch in front of you. Could you just walk me through what they can expect?
Yeah, you've heard that, and I've heard people be really concerned about them judging them or criticizing them. We're going to tell them what to do. And those are three things I don't do at all, as a matter of fact. I really feel my role in helping a patient is to work with them to find the underlying cause of the symptoms. The symptoms are generally just a tip of the iceberg. There's some conflict underneath that we need to get to figure out. And that can't be accomplished if I'm taking the patient over, telling them what to do. It's more collaborative, because you can't fix a problem unless you know what the underlying cause is.
Almost like putting the pieces of a puzzle together.
It's just like that, actually. It's almost like working on a jigsaw puzzle.
You're also a psychiatrist or an MD. How is that beneficial to patients?
Because I am an MD and I practice psychotherapy, a patient can see me for both therapy and medications. So it's sort of like a one-stop shop. So if someone doesn't have to go see a therapist and then make another appointment to see a psychiatrist, I can take care of the medications and the therapy in one session.
Great. Well, thank you.
It's so sad and frustrating to me that there is a stigma attached to getting help for emotional problems. So if you need help, I hope this information about what to expect when you come into my office helps you make that phone call.